And so I'm welcoming everyone. You're welcome to the webinar. Let us know where you are joining us from any part of the world. Joining us from, please. We'll just use that to take some time so that more people can get in to the webinar. Okay, Kunle Odunyemi from London, you're welcome to the webinar. You're welcome.
Thank you, sir. Oduyemi, sir.
Oduyemi, I'm sorry about that. I'm really sorry. Apologies for that. Yeah. Sorry, apologies. Okay. All right. You're welcome. Let us know where you are joining us from. Yeah, and then thank you very much for joining. We do not take it for granted. Let's know where you're joining us from as you get into the meeting. Okay. Yeah, welcome everyone. And we would also like you guys to be on mute so that we don't have so much distractions. Okay, so guys, let's know where you're joining us from. As you come in, let's know where you're joining us from so we can kick off as soon as possible. You're welcome, guys. This session is also being recorded, so after the meeting, we can make the recording available to everyone. And then we also like you to know that we have a group on WhatsApp that you might be interested in. So if you're not a part of the WhatsApp group yet, we want you to be a part of the WhatsApp group, and the link will be shared shortly in the comment section, so you can just click on it to get into the WhatsApp group. Can you help us with the link? Abisola, can you help us with the link?
Yes, please.
Okay, thank you. So the link will be in the comment section. You can just click on the link so that you can be a part of the general group on WhatsApp, so you can have access to all the information that will be passing across. Let us know where you are joining us from, guys. As you're joining in, let's know where you're joining us from so that we can just take some time to wait for more people as they join us. Okay. So this webinar is made possible and organized by an NGO called Community of Nigerian Healthcare Professionals in Diaspora. And I'd just like to say one or two things about what the group is all about. Just like you already said, it's a non-governmental organization, non-profit making organization with a vision to shape and impact policies for the health sector, for enhancing the health sector. And we're particular about healthcare professionals, Nigerian healthcare professionals in diaspora, and how they can support the work that is going on in Nigeria, which is their home country. And that's what this group is all about. So, and we believe that you joining this group indicates that you are also interested in what the group is all about. So we have a common front that is uniting us all together. So we want to bring that group together where we all believe in the same things, we have the same goals, and we are hoping to achieve the same results. And one of the things that we also want to do is to help people to link up with stakeholders. You know, we're talking about developing the Nigerian healthcare system, and there are quite a number of stakeholders that are involved, from government, you know, to everyone involved, and we want to form that link where Nigerian healthcare professionals in diaspora can be able to have access to all the stakeholders involved. And then, because we can only make progress when we work together, because it's not just a one-man show. So we want to make that link available. We want to be that link that can make Nigerian healthcare professionals in diaspora have access to, all the stakeholders that are involved. We also want to be an avenue for partnerships and collaborations. Just like I said, it's not a one-man show. So everyone is involved, and we just have to collaborate. We just have to form partnerships amongst ourselves, from medicine, from medicine, from physicians to dentists to nurses, pharmacists, medical lab scientists, physiotherapists, occupational therapists. We just need to form alliances, and we need to form partnerships. And that's one of the things that this group is all about. We aim to foster that partnership and alliance and collaboration amongst ourselves, because that's the only way to move forward. And this is going to be possible by the involvement of everyone. It's going to be possible by the involvement of everyone. So we want everyone to be involved in one way or the other. There are people who definitely are not going to, who are not going to come back home, to do any kind of work whatsoever. That's okay, and also there are people who we definitely have to come back because they want to, they want to come back to their country and do stuff to, improve the healthcare system, and that's fine. And there are also the hybrid group too, who will neither come back and will neither stay, they just want to go on and off, and that's fine too. But the main goal is to make sure that everyone is on board and we are all doing something to improve the healthcare sector. So it's not just about coming back and then all that. If you don't want to come back, that's fine too. But that does not mean that, there are still not things that can be done even while you're away. So it's a collaborative effort, and this group is meant to help us to achieve those things and goals. And I will still talk about this, some other things in a short while, but we'll have to kick off with the main agenda for today. And we are privileged to have in our midst this evening our keynote, or our speaker and our panelist for today is Professor Jaiyesimi Rotimi, and he's a member of the Federal Government's Advisory Council on the Nigerian Health Professionals in Diaspora Close Engagement Program. So he's really informed and he knows a lot, and that's one of the reasons why he wants to share with us today some of the things that we can do to harness the potentials of Nigerian healthcare professionals in diaspora. And I tell you, you're going to be glad that you're part of this meeting today. He's a consultant, obstetrician and gynecologist, and he's also a global health expert, and is a group associate MD for patient safety at Mid and South Essex NHS Foundation Trust in the UK. Some of you guys might have met him at one point in time or the other, and some might have not. And so I want us to welcome this evening Professor Jaiyesimi Rotimi. Welcome, sir, to the...
Thank you, Dr. Kinshiku, for the kind invitation to speak at this event. It's an honor, which I don't take for granted, and it's an opportunity for us to engage in the health sector in Nigeria to see how we can improve it. So I will leave it as that. I do not have any conflicts of interest to declare, other than to say that I am proudly Nigerian.
Thank you very much, sir. So we just kickstart the program. We'd like to know, we'd like you to tell us about your story, your career from graduation and up to now. We just want to have an idea of what you've been up to, and how you've progressed from one stage of your career to the other and where you are right now.
Doctor, thank you. I will try and make it as brief as possible. I graduated from the University of Ibadan in 1978 and did my internship at UCH, following which I did my youth corps in the then Bendel State, probably called not Edo, Delta State now. After youth corps, I started my training in obstetrics and gynecology in 1980. And as part of the program, it's a 7-year program, you are allowed or expected to go abroad. Again, go abroad to go and see how medicine is practiced in other lines. And I went to Dublin in 1985. And my plan, my desire as a doctor was to have my own hospital in Nigeria. So when I left Nigeria in 1985, the plan was to go back in 1986. But events undertook that. I got a paid job for 3 years. So I stayed on and did my membership of the Royal College of Obstetrics and Gynecology. That took us to 1988. I had also done my West African College Fellowship, 1986. In 1988, we were warned that the economy of Nigeria was shaky by the late Chief Obafemi Awolowo. Now, unlike parents of those days, I mean, you came, you studied, and you went back, there was a job waiting for you. But I was advised that, look, things are not very stable, uncertain. If you've got a job in the UK, stay on for now. And that's how I stayed on the UK. And that's how I still remain in the UK, unfortunately, because, like I said, I'm a Nigerian. I was trained by Nigerians. The investment was from Nigeria. And my desire is to give back to Nigeria. So I did my postgraduate training, and I became a consultant in obstetrics and gynecology in 1993, started working in 1994. The first Nigerian to be appointed as a consultant in obstetrics and gynecology, and that was at North Tyneside Hospital in the Newcastle area. I was a consultant there for 20 years, and during that period, I did an MBA, not because I wanted to be a businessman or into administration, but just to understand managing hospitals and how businesses were run. But my interest was in patient care. So I did a lot about clinical governance. And when an opportunity also came around, I did a master's in medical law, so an LLM in medical law. And so I was a consultant for 20 years. Then I moved down south to Essex, where I am at the moment, Mid and South Essex, as you said, because the hospital was under special measures. The hospital outcomes were not good. A lot of patients were dying, and they wanted somebody to help turn it over. And that's how I found myself in Essex, and that is where I am at the moment. In the global health aspect, I've been to Nigeria, I've been to Shagamu, I've been to Abuja, I've been to Abeokuta, I've been to Oyo, I've been to Babcock. So I give back to Nigeria in various ways. I have lectured at the law school in Abuja in terms of shaping policy. I have also lectured at Nigeria's highest strategic thinking organization in Kuru, NIPS in Kuru. And we might talk about that later on. But I want to make it short. It's not about me. It's about the program. So I don't want to go on and on about myself. But if questions arise, then I will address it. So that is the simple man I am. Thank you.
Yeah, thank you very much, sir. You're a member of the Federal Government's Advisory Council on Nigerian Healthcare Professionals in Diaspora Close Engagement Program. Can you tell us what that is about? What is that initiative about?
Well, that initiative, that particular one you're mentioning, started last year by President Tinubu's administration. But there are precursors to that one.
Okay.
The very first official precursor to that was what we called the Presidential Initiative for Medical Excellence. And the acronym we took was PRIME. Then PRIME and PRIDE. The PRIDE was stood for Presidential Initiative for Diasporan Engagement. So it was about getting diasporans to come to Nigeria, that's the engagement, and also about medical excellence. And this was a presidential initiative led by Honorable Abike Dabiri, who was the senior special advisor to President Buhari at that time. And I was approached and appointed as the chair of that program, Pride and Prime. And we took that on till about 2018, 2019. And because of, I don't want to go into the details, we had to merge it with a similar program. And then it became the Diaspora Engagement Plus. The plus in it was that it doesn't have to be Nigerians alone. Anybody who wants to come, whether you're Caucasian, American, if you want to come, we will welcome you. unfortunately, I mean, we were ready to go to Nigeria in 2020, but unfortunately, the then Minister of Health shut down the program, the mission, saying if it failed, they will blame him. There was a budget line for it, but it didn't take place. But with the new administration, they've seen the value in it because you have about 3 Nigerian doctors, if not more, leaving the Nigerian waters every day. You have 11,000 or over 11,000 Nigerian doctors registered in the UK. Not to talk of how many in America, how many in Canada, how many in South Africa. Globally, there are Nigerians. So the government of President Tinubu wants to see us come back with our expertise to collaborate with our colleagues in terms of improving healthcare in Nigeria. So that's how the Nigerian Health Professionals in Diaspora Plus engagement program came about. There is the technical working group. So they are the ones who do the running around and the technical aspects. And I'm a member of the board of advisors to the program. So that was late in the middle of last year. So the program is in its infancy, and so things are being prepared, and you will hear more about it once it's concretized. So that's where we are.
Oh, okay, sir. That's good.
Just one thing I would say. I know we're mentioning doctor. This is not about doctors. It's healthcare professionals. So please, if I slip into saying Nigerian doctors, it's not because we're doctors. It's doctors, nurses, occupational therapists, physiotherapists, laboratory services in the diaspora. We need everybody to come back and help. And the other thing I would say is we are not going to Nigeria to teach anybody anything. We are going to share knowledge and we are going to learn from them. So it's a collaboration bi-directional. So that's the whole plan.
Thank you very much, sir, for spelling that out clearly. In what ways can the healthcare professionals, Nigerian healthcare professionals in diaspora, in what ways can they prepare to be a part of what government is doing, for example, with that initiative?
Well, I think it's number one, being optimistic about the country. There's a lot of bad press about Nigeria, insecurity, bad roads, no electricity. But the number of people who die in Chicago, New York every day is more than the numbers of people who die in Nigeria. Gunshots in schools in America is a lot, and people still go to America and they don't complain. So for the Nigerian professionals in the diaspora, we need you. And yes, it could be 1 week that you come and spend in any of the hospitals that's decided. We were going to do the 6 geopolitical zones, pick 6 centers where you use your expertise. So that is what we want to do. And why this group was set up, I mean, people have been going on missions. You go on missions for a week or for 2, then you leave the country and you operated on patients, but you go back. Then complications arise and there are no people on ground who know what to do. So this program is to ensure that there is a rolling, structured program whereby there will always be a group of diasporans in Nigeria working alongside our Nigerian counterparts. Like I said, we are thinking about it. One of the things that will probably occur in future is the use of telemedicine. I don't have to be in Nigeria to help them in theater. There's robotic surgery. If you have a link to a hospital theater in Onitsha, you can discuss with them. Yeah. If there's any difficulty, you can help. So I think it's a good program and we should support it. And I want to commend you for what you are doing. And having had this discussion, I'm sure at some point in time, you will engage with the Ministry of Health as we go forward, as to see where you fit into this. So thank you.
Thank you very much, sir. It's so good to know what government is doing on their own part. But I would like to ask, what are your thoughts about what we as healthcare professionals in diaspora, what we can do on our own part by ourselves now. Let's leave our government, out of it, assuming that we're expecting them to come out with something, credible and workable. What can we as Nigerian healthcare professionals in diaspora as a group, what are some of the things that, what are your thoughts on things that we can do as a group by ourselves to kickstart and initiate some of these processes?
Yeah, well, most of the disease burden in Nigeria can be managed in primary care. You don't need to go to the teaching hospitals or general hospitals. We need people in the primary healthcare centers. And yes, we might be specialists in our own rights where we are, but primarily you've got an MBBS and you can treat malaria, you can treat diarrhea and things like that. So if you're going to start, like I said, the disease burden is in primary care. And one of the things that some state governments are doing is asking people to adopt primary healthcare centers. There are 774 local government authorities, and more recently, local government authorities are being given some independence to run their affairs. They're going to have their budget. We still don't know how it's going to work out. So as a diasporan, you can either key into the primary healthcare sector. You can see if you can adopt a number of primary care health centers. And when I say adopt, you will help them run it, help them with the protocols, with the guidelines, continuous learning, making sure that quality care is delivered in those centers. Most of the care in Nigeria is in the private sector. But the question is how many people in Nigeria can afford to go to private hospitals? Very few. So that's why I said maybe we should be looking into the primary care level, but not also forgetting the secondary and tertiary care. And one pertinent question you said is, how do we help? Is there any seamless link, referral link between primary and secondary care and tertiary care? It's there, but it doesn't work well. So you have, and you and I have a role to strengthen that by saying, look, have you thought about this? This is how it works. Why don't you have a referral pattern so that if there's a problem in primary care, then they go to secondary care? And we have to think outside the box. Do we have ambulance services? What do we do? Do we set up an hospital Uber kind of thing? Or even improvise? In Tanzania, they have those keke, what do you call it? Keke marua. And behind it, they have like a long bed that's supposed to be like a mini ambulance. So if a patient is sick, there's that bed and that keke marua kind of thing will take that patient to secondary care. So we have to be innovative, imaginative in what we try and do and in our suggestions to the ministry or to government. We cannot work without government. You're going to need your MDCN registration. So you cannot just go in without being registered. So you still need that. Again, government, they want to engage with us. The former minister, Dr. Tunji Alausa, he left America. He is a renal doctor in America. He's seen the good, he's seen the bad, and he wants to replicate that in Nigeria. But he's moved into education. But he is certain that the person who is the minister is also capable. You've got Mohammed Pate, Professor Pate.
Yeah.
He's a world-renowned public health person. So we have good people who want to do something. So our own role is to support them in achieving what we want to do. I don't want us to work in silos. We've been doing that since maybe the 70s. People go to mission hospitals. People go to their villages on missions. But no, we need that critical mass where we're talking to each other and where there's a rolling timetable of who goes when and where. So I'll leave it as that. Thank you.
Yeah. Thank you very much, sir, for those insights. But one thing that stuck for me was when you were talking about the different aspects that are available for involvement, just like not everybody can get into setting up an hospital or doing all that. And I think there are several ways by which you cannot be involved, and because of the exposure that we have, we know that there are several things that can be done. For example, there's the AI, there's the technology that we see around us in our hospitals where we work. Some of these things can actually be scaled back home. There's the issue of training, right now we know what goes on with the training of the workforce back home, that area needs a lot of, a lot of investment. There are people that can come back home and say, hey guys, I want to set up a training school, a nursing school where the standards are going to be kept and everything, and it can work. Government is going to be involved, just like you said, and that is contributing our quota, individually now in what we do. There is the providing support, different forms of services that can take place apart from it just setting up and setting up a clinic, an hospital, a primary care center, and all of that. So there's a lot of work that can go on, a lot of services. And recently I've been doing something about a research in like a framework for investing in the healthcare sector. And I discovered that there are a lot more opportunities that are open, not just when we talk about investing or coming back to do our own quota, we think that, oh, it means that I have to set up a clinic or I have to set up an hospital or I have to, but I just discovered that there are a lot more things that we can actually do apart from that, and when I'm done, I think I'll be able to share some of those things with us so that we can be aware of the several ways that are open to be involved in. There are a lot of things, and we see these things around where we work, and we know that it has got much more to do than just setting up clinics and all of that. So I would like to ask Prof, sir, what are the things that can be, for somebody now who's thinking of getting involved? And I usually say this, whether we're thinking of coming back or not, we just have to get involved because it's just a necessity. That's the truth. We just have to get involved one way or the other, And of course, it doesn't have to be charity. We don't have to do charity. We don't have to. But whatever we do will definitely make an impact in the lives of our people, of Nigerians. I want to ask, for somebody who's thinking to get involved in one way or the other, what are the stumbling blocks or what are the things that you think that they need to be aware of or they need to get prepared? Yeah, well, I'm saying this generally across board now, whether you're a physician, a dentist, nurse, physiotherapist, occupational therapist, laboratory technologist, pharmacist, or whatever it is. What are the things that you think that people need to understand first? Because, people can't just wake up one day and say, I'm going back home to go and do this, or I'm going to do that. What I think that you think, based on your experience, that I think people need to be aware of, stumbling blocks that they need to be aware of, and things that they need to do to be prepared for such experiences.
Yeah, thank you for that question. You may recall that when I was speaking, I spoke about bi-directional learning and collaboration. It's expensive if you don't have money, you cannot set up a hospital. And I'm not advocating that people go back to build hospitals or clinics and stuff like that, but it's to transfer your technical skill and non-technical skill. And I'm happy you mentioned education and training. What people can do, you can either go physically and train, or I mentioned telemedicine or AI.
Yeah.
I'm a visiting professor in law in UI. I've done lectures virtually from my office in the UK, lecturing students in Nigeria. So teaching, you can do that. Again, there's a lot of money out there, people wanting to support issues. I mean, I go to the IDP camp in Nigeria in October for a week through a charity. We've been going on our own through a charity, but now we have UK government funding. We're also doing training for basic emergency in obstetrics and neonatal care. So that training aspect, you can key into it. But you did ask a pertinent question. Most of us trained in Nigeria, we know the climate. Yeah, and like I said, people are afraid of security. You know where you're going to go. You're not going to, is it Mambila Forest? No.
Yes, sir.
You won't go into those areas that is not safe to go.
Yeah.
So most of the areas you will go to are safe. At times you get security with you. And I mean, we've been going since 2017 and we've had not even one issue at all, that kind of thing. So what people worry is, oh, security, accommodation, will there be light? Will there be water? All of this are surmountable things. We have not encountered any issue that will say, oh, don't go to Nigeria. I think one problem as Nigerians we do, we talk bad about a country and it affects our children. Then when you say, let's go on holiday in Nigeria, they say, Daddy, that country you said is dangerous. I'm not coming. Nigeria is not as bad as that. So the thing is to change our mindset. We need to change an attitude about Nigeria and be ready to go. Our parents still live there. Our brothers still live there. family members still live there. And unless we improve the health system by training, by going there, by talking to them, by sharing experiences, you don't even have to be there physically. I can tell you, as of last night, we were talking, when I say we, a company, Mobi Health, was talking to a big group in America and Puerto Rico about teaching and using different platforms. So there's, like you said, there's a lot to be done. And it's identifying what needs to be done, prioritizing what needs to be done, again, identifying your own skills, because you don't want to go and practice beyond your skills.
Yeah.
If you do, and you make a mistake in Nigeria, your registration in Canada or in America or in the UK might be, if you're struck off in Nigeria, then you have a problem in Canada or in the UK if you've committed a medical error. So I will leave it as that for now. But there's a lot to do, and I'm happy you said you have a framework. And I'm sure out of this meeting, there will be more discussions about how we can achieve this vision. Thank you.
Yes, sir. And that reminds me, Prof, there's something that we're also trying to do as a group, and that's having a liaison center, where people, for example, who intend to do one thing or the other, and they are in diaspora, where they can easily go and say, oh, hey, this is what I want to do. And then they can have information, they can have support, all the, and that will be able to bring that idea to reality. Because doing it individually, like going out to find out about a lot of things might not be possible in that sense, for someone who has been away for a long time, might not really know where to go and all of that. Recently, a senior colleague of mine was speaking with me, and he's in the UK, and he said he would really, really like to, set up, like he said, because of the distance from, where his family is and all of that, that he really want to set up like an health facility around that area, because they didn't have any. People had to, go very far to get access. And he said he really want to do that. And I really, commended, that desire, because I understood what he wanted to do, but things need to be done in a certain way, because you can't just rush into it and that. So one of the things I want to do is to have that center where people can go to, they can connect with, and then they can easily be able to get all the information they need, and then they can be able to achieve their goals and their purposes. So in essence, we will also be helping people to bring their dreams and their goals. We'll be helping them to bring it to reality, and we'll be helping them to facilitate that. So it's one of the things that we're also looking at, because we actually need we need people on ground to be able to get these things done, to help with getting these things done, because there's a little you can do when you are abroad and you want to get certain things done. Sometimes you just have to be on ground to get things running, because we know the way Nigeria is, you can't get stuff done online. You send emails and you get a response immediately, and then sometimes you have to be physically present, and then you have to see people, they have to see you, and before anything moves an inch. So we are trying to do that, set that up so that people, because it's something that it's something major, it's a step that needs to be done, because people can say they want to do something, but if they don't have the means of doing it, then they just get stuck and there's no one to help. So we can keep saying, oh, we need healthcare professionals in diaspora need to get certain things done and they need to come to help. But if there's no avenue to actually help them, if there's no avenue for support, then it leaves that gap and everybody's just going to get stuck. We are not going to move forward in any way. So I think that liaison gap actually needs to be filled, and is one of the things that we are looking at to do. I would like you to talk about some of the standardized practices and patient safety that actually need to also come into play in all of this, because it's also very, very important, and I know it's one of is your field and your specialty, sir.
Yeah. The good reason and why I commend you for this webinar is it gives information. Yeah. You use the word liaison center. It is there in the Federal Ministry of Health. They have a diaspora unit, and they are very helpful. You've got the Nigerian Diaspora Commission, led by Honorable Abike. Yeah. Again, they're very helpful. Now, let me give you one example. We went with about 90 kilograms of theater scrubs to take to University of Abuja Teaching Hospital. All we had to do was to speak to the Diaspora desk, NIDCOM, to give us clearance from customs that, look, we're not selling this, we're bringing it in as charity. And we had documents that they gave us. So when we got to the airport and they saw it initially, went through the scan, oh, Oga, stand by. And when we showed them the document that we had gotten through the help of the liaison center, we were allowed to go in. We've taken mannequins in, you understand? Again, when there's a diaspora center or unit in the Federal Ministry of Health, and the also good thing is most state governments are now having diaspora units in their in their health ministries. So the liaison center is there, and talking to you and working with you, I'm sure these things are surmountable. So that's talking about the liaison center. Now, about the quality of care in Nigeria, it's not as good as I would want it to be. We hear of many horror stories of things going wrong. We hear of doctors who are probably not trained to do a number of procedures, doing it with poor outcomes. Nigeria is not short of regulations and laws. It's the application and enforcement of these laws. So where you and I come in, again, is to talk to people about quality and standards, about the WHO checklist, about antimicrobial resistance. Is a global thing. It's a global problem now. Again, we talk about it. I'm involved with Babcock Hospital through a grant from the UK government to help them strengthen their antimicrobial stewardship. So the thing is, we've got to keep talking, engaging with different people, more so those who want to engage. Not every facility you go to want you. They think, who are you? What do you want to come and teach us? We know more than you. We know more tropical disease than you. You've come in from Canada. So what do you so but you understand, let us engage with them. Patient safety is global. In America, medical errors is the third commonest cause of death. In Nigeria, a lot of things happen. Public education, patient education, and I said something initially. Medicine and nursing is not about just the knowledge, the non-technical skills. How do you respect the dignity of patients? How do you address patients? You don't shout at patients. You have to treat them as human beings. So, and I was keynote speaker, I think it was yesterday, in a hospital, private hospital in Lagos. And after I presented, I sat to listen to what they were doing. Yeah, it's a private hospital, but I tell you, it's world standard. Okay, and that is in Lagos. So we will get there if we keep talking and being advocate for the patient. Advocacy is important. Nigeria has a patient's bills right. How many people in Nigeria know about that? Unless we keep educating them through what you're doing, through LinkedIn, through whatever social media platform you have, and talking, then I think eventually, as they say, Rome was not built in a day. Little drops of water make the ocean. So the little bit we can do, you and I and others can do, don't let us despair that, oh, it looks small. No. Let me ask you this, or tell you this question. You might train one dentist. You might have 10 dentists in the room. One dentist listens to you. Wow. And he says, oh, I like what I'm hearing. That dentist goes away and trains 100 dentists. You will not know that. So you will not know the ripple effect of what you have sown. It's just sow that seed. And some people will run with it. And eventually you will get to know, because people will come back years later to say, you remember that day you came and spoke to us, see what we're doing. So it's not a quick fix. It's not a quick win. Yes, we'll look for the low-hanging fruits and deal with those. The more complex one will be long-term, medium to long-term approaches. But I think we're on the right path in terms of ensuring quality and experience, patient safety and patient experience for our patients. When a patient dies, do we investigate properly? It's not about blame. It's about learning. Why? What did we do that resulted in harm to the patient? If we know what we did, then we can learn from it so that it doesn't happen to another person. But if we don't investigate, and we don't, it's not about punishment or castigating the doctor or nurse. No. Investigations are about learning now. In the UK, it's about learning. It's not about, it's only if it's willful. It's only if every time you take a patient to theater, they're bleeding, you tie the ureter every time. Then they'll say there's something wrong with your practice. That's where a problem is. But that's not common. But we will get there. We will get there.
Yes, I believe so. That's one of the things why we are coming up with webinars like this, so that we can start the conversations and initiate the process of awareness. On a passing note, what will be your final words to? I know most guys are in the UK. What will be your final words to Nigerian healthcare professionals in diaspora, across all boards? Those who don't want to come back home, those who want to come back, or those who want to be hybrid and stuff like that.
I will encourage Nigerians who want to go back home, if it's for 1 week, if it's for 1 month, if you want to take a sabbatical for 1 year, to please go. I mean, Nigeria is a good place. It's a good country. Look at in America and Canada, wherever Nigeria, people say, even Caucasians say it. If you get to a country and there's no Nigerian, run away from that country. That is how good a people we are. We are a different breed. When you look at the North American statistics of what Nigerian doctors are doing, what Bayo Ogunlesi is doing, I mean, Kunle Odunsi and co. I could mention names. Funmi Olopade was in the Obama Cancer Research Group. They are Nigerians. They trained in Nigeria. So my plea to my Nigerian colleagues in the diaspora, in all aspects of healthcare, let us give back to our country. Let us build. Look, Aki, what's happening in America now with President Trump in terms of immigration is deporting as many people as he can deport.
Yeah.
So we are not. This is not. Canada is not your
country.
UK is not my country.
Yeah.
A prime minister could come in 2 years' time and say, if you were not born in this country, off you go. And if it's honestly, and if it's legislation, so where's your home? Your home is Nigeria.
Yes, sir.
Yes, we are abroad. So let us not forget home. So my last word, Aki, Nigeria is a good country. Yes, it has its problems. Every country has its problem. It is for you and I to make Nigeria a better country. I always say this. My mantra is each Nigerian life, every Nigerian life is priceless. You cannot quantify it. So Nigerians shouldn't be dying. Mothers shouldn't be dying as a result of pregnancy and childbirth. Yes. So the clarion call is to the diasporans, let us engage with government. Let us see where they need our help. And let us help them. Let us even give them ideas of what to do. And I'm sure with the people in government at the moment, yeah, they will make a difference. So that will be my plea and my closing remarks. Thank you.
Thank you very much, sir. And lending a voice to what Prof just said, I also want to plead, because I know we have so much challenges, infrastructural challenges, workforce shortages, health financing is a big one, and then the major one, the brain drain, and there are a lot of stuff to deal with. But I'll just plead with, Nigerian healthcare professionals, please try and find a way to be a solution provider, because that's the only way we have, that's the only way we've got, and just like Prof said, no matter how many nationalities or citizenship you can get, Nigeria will always be your home, and that's very, very important. And that's one thing that we need to key into, that we also always want to look at, because that is very, very important. And, when we talk about giving back, a lot of people think it has to do with something free like charity and all of that. Well, it doesn't have to be, because definitely when you are providing a solution, solution will always bring about the financial emoluments and all of that. So it's like you are trying to kill two birds with a stone. You are providing a solution, and you are also giving back, and at the same time too, there's also the financial inducement that comes with it. Definitely, if you are providing a solution, you will always have some economic activity going on, and in that way you'll be helping yourself and also helping the country, especially the health sector. So I want to employ all of us to find out things that we can do back home in Nigeria to improve the state of the health sector. It's actually in a mess right now. To actually get skilled workforce right now anywhere is so difficult. I'm telling you, so difficult, and it's actually worse off in rural areas. You know, like I spoke with Prof earlier, we have the rural urban migration that is on its own. We also have the international migration, what we call the brain drain, but the rural areas get the worst hit off, because nobody wants to work in the rural areas. Everybody wants to work in the big cities. Those in the big cities too want to get out of the country for greener pastures and all of that. So there are a lot of stuff that we are dealing with back home, and we need to find something, a critical area to be involved in. And I want all of us to be a part of what we are doing. There's a WhatsApp link in the comment section. Please try and get into that link and then get into the WhatsApp group so that we can all form a formidable group to tackle some of these challenges one after the other. Our involvement and all of that are really, really important. And before Prof leaves, I want us to take some questions. If you have any question, if you want to talk directly to Prof and you want to ask the question directly, please feel free to do that. Just raise up your hands. And if you want to put your questions on the chat box, you can also do that. So I want us to take the questions now quickly so that we can get this wrapped up. So anyone, you have questions, let's have you. You can put it in the comment section, or you can raise up your hands and then you ask your questions.
Just to add to that, we usually say whoever asks for directions never misses the road. I also say there's no question that is stupid. And so I usually like people to ask questions, things that you've heard today, things that you've heard, or things that's been bothering you. If you don't ask today, then we can't address it. So please, I prefer questions rather than talking to people, because I know what I want to do, but I don't know what people's fears are. And unless you tell us, yes, we can tell you, try and explain what's going on. And I'm happy we have 2 hands up. So we'll take questions. We've got 2 electronic hands up. I think the first person was Rosalind Ate.
Yes,
Okay.
thank you. Good afternoon. Thank you so much. This has been really informative. My question is around the standards of care. I know you mentioned that enforcement is not really is non-existent. But how can we make that happen? So you think about in the United States, right? We have the Joint Commission who comes around every so often to make sure the standards are being kept up. But how does something like that exist? And if not, how can we help to contribute towards that, to ensure that the quality of care that's being provided in all these different health centers or hospitals are being of good quality?
Yeah, thank you for that question. The regulatory and enforcement divisions, they are there in the Ministries of Health, the Medical and Dental Council, the Midwifery and Nursing Council. They have regulations. Now, the thing is, when things go wrong in Nigeria, at times people don't want to complain. They say, oh, it's God's will. If it wasn't God's will, it wouldn't have happened. So even, let me give you an example. There was a patient who died. And I like I said, I do medical law. And I contacted Jay the singer to say, look, I'm prepared to do services pro bono, free, to look into this case as to why that patient died. But the family was like, oh, leave it alone and that kind of thing. Again, I can reassure you that if it gets to the MDCN or any of these regulatory bodies, there are panels that sit to listen to it. There was a Nigerian army doctor who did something some years ago, and he was fined about $900,000 then, not now. So the system is there. It's just for us to advocate. Again, in the UK, we've got something called the duty of candor. When something goes wrong, you must report it. But in Nigeria, at times, is just leave it alone, sweep it under the carpet. And these things happened. It happens in America. It happens in the UK. But we, as professionals, have to be the voice of patients. We have to be the voice of patients. So that is what I would say. And don't lose hope. The little you can do, do it. there are things in my mind that I think I'd want to do, which I'm sure I will try and do. Let me give you the example, universal health coverage. I said I did give a lecture in Kuru, and I said, look, why don't we Nigerians telephone and speak for hours? We can gist a lot. Take 10 kobo of every phone call and put it in a pot for universal health coverage. And I mentioned that at Kuru during my lecture. And as we speak, just before Vice President Osinbajo left, they put it in some document. They called, I didn't want to use the word tax, but they are going to tax telecom companies. And the money that they get from them is going to go into a pot to support the health sector. So little things, if it comes to patient safety, we're still going to talk about that. We're going to address it. I don't know what your background is, Roslyn, but again, when you have a critical voice, you're talking, I'm talking, we're coming together to say this is not right. We seek audience with the minister, we will get there. But if it's just one lone voice in the wilderness, then it's difficult. So if you're in patient safety, we're all in patient safety. The oath is, first of all, do no harm. That's patient safety. So let's come together as a group. I will encourage you to join the chat group that Dr. Akenshiku has formed. And I'm sure it will, at some point in time, feed into the government's program. He also mentioned something about financial. Nothing, yeah, there are people who go home and before they go, they've got cases lined up for them for breast surgery, for thyroid surgery, and they get paid for it. So there are different aspects of it. And if you want to be charitable, you can also do that. If God has blessed you, you can do it. So, and like I said, if we have a good structure, there's money. There are people out there wanting to give money to people. But at times when they hear Nigeria, they run away because when they give us money, we don't use it properly. But we are getting better. So thank you.
Yeah.
Thank you, sir.
Yeah. And let me just chip in this. I think the next conversation we'll be having will be around.
Before you go, there's Tomilayo's hand is up.
Oh, yeah. I just wanted to chip in something before she comes up.
Okay.
I was trying to say that our next conversation will be around the areas of financing and investing, because we'll be having someone or a group of people who are in the investment circle, and they're interested in financing healthcare and all of that. So there, like Prof said, there are a lot of opportunities that are available for financing, and we'll be taking them one after the other.
Yeah, before Toby comes in, just to tell you there's financing. There's a hospital that's going to open in June, July in Abuja, called the African Center for Medical Excellence. It's about a 300-bed hospital. King's College London is behind it. So the quality is going to be there. The chief executive was recruited from America. He's not a doctor, but he's a manager. Money came from Afrexim Bank. Money came from private sector. And when we even query them to say, well, it's okay to build this hospital, how are the poor people going to benefit from it? And they said, look, there's a floor out of the multi-story building dedicated for patients who cannot afford to pay, that they will be looked after. So there's money out there, and we'll get there.
Yeah,
So,
well, let me just let the cat out of the bag. We are planning to talk with the chief nursing officer of that program. Yeah, she's
yeah,
coming up. Yes, coming up in February. I already spoke
yeah.
to her, and she's from the UK. I don't know if you know her.
I know her.
Yes, so she'll be on the webinar next month. I'll be talking
Yeah.
to her, be hearing more about what that project is all about. They'll be opening it very soon.
It'll be awesome.
Yeah,
Okay.
really awesome. Yeah. Yes. Okay. Yeah. Tommy, can we have your question?
Yeah, good evening. Good evening, sir. Thank you very much for your time today. My question is, as I'm a nurse, I work in the UK, and I have interest and passion to give back. I'm just trying to think about the practical steps that I need to take now. So from what you said something about the liaison center, and a couple of things that I didn't know before. If I want to start something now, either individually or collectively, what are the steps that I need to do? The first thing coming to my mind is you mentioned talking to the diaspora group. That Abike Dabiri is the chairman. Is that the first thing I need to do, or what is the first thing I need to do if I want to give back?
Can I ask you, are you a member of the Nursing Association, Nigerian Nursing Association in the
Yes,
UK?
I am. Yes, I am.
Right. So you know Wendy.
Very well, I do.
Right. The Nigerian Nurses Association in the UK is part of this program, this Diaspora program.
Right.
The Nigerian Nurses Association in the UK, you know about the Doctors One Mansag.
Yes, I do. Yeah.
So again, these groups have come together talking with government. So I would say if you are interested, be active in the group. You understand? If you want to have a discussion with myself, I'm sure if you speak with Folari, he'll give you my details, or you can find me on LinkedIn or something like that. And again, if you want to do voluntary things, we're looking for volunteers. What's your specialty?
I actually work in digital health at the moment. I'm an EPMA clinical nurse specialist at the
Well, you
moment.
work in digital health. That's awesome.
Yes.
We need it. You understand? Like I said, yeah, we'll talk outside of the meeting. But please, the first point of contact is let us talk about it in here. Then we have a concrete program that we're saying, okay, we're going to Lagos or to Abuja to talk to them. Without that, if you just go alone, they'll say yes. But by the time you come back to London, they've forgotten about you.
Yeah.
You understand?
Yeah.
So let us, we need to work together. How have the Indians done it? Is by
Yeah,
working together. If you
absolutely.
going to India, even Americans are going to India for treatment. And how did they build their system in India? Their diaspora doctors and nurses went back to India to do things, to teach, to set up centers. So we can do it as well if we work together. Yeah. Thank you.
Thank you very much. Thank you, sir.
Yeah. Okay, I think we can have only Oduyemi. Yeah, you can ask your question, sir.
Yeah.
Is that me?
Yeah, we can hear you.
Okay, sorry, sir. I was just, thank you very much, Prof, and thank you very much, Mr. Folari. I just want to ask a question. I know you've said a lot about things about going back home and all that sort of things. But one thing I'm interested in is this. I'm at that age now whereby I think I've done my bit and I'm about to retire from the UK. And one of my things I want to do is I'm looking back to what can I do if I want to go back now. And you've highlighted a lot of things, especially with the diaspora and this diaspora and community. But like you rightly pointed out, we have fears. What would it be like? I've had an uncle who relocated back home after several years in Canada, and I don't want to use what it was duped. It fell into the wrong hands and it was duped, and he lost his livelihood. And he became disillusioned with the whole thing. And you want to go home, you want to set up things, you have good plans, you have good thoughts, but you've steered us in the right direction. I'm a part of the NSCA, I'm a part of some of the things that's happening here. How do we ensure that we don't get into the wrong group or fall into the wrong hands when we get there? I know that a lot of people who sees you as a meal ticket as soon as you step into that country, and that's some of the fears that some of us carry. I don't know if I'm speaking the right thing, saying the right things there.
You are speaking the right thing. But what I would say is, if you have money you want to go and invest, you've got to do your due diligence. You've got to know who you are dealing with. You've got to get the legal people involved. There has to be non-disclosure agreement. It has to be watertight. It's your money. So you have to make sure that, I mean, corruption is everywhere. People get duped in America, in Britain, and in all sorts of places. So it's not a Nigerian factor. But if somebody sweet talks you and then you just believe what they tell you, oh, that land is mine, my father gave me, give us $2,000, then no, you have to do your due diligence. You go to the lands registry, who owns this land, buy government land instead of going to Omonile and all that kind of thing. If it's a financial transaction, you've got to ask people about who you are dealing with. Let me tell you, I mean, Ruth Marcel Cancer Center in Lagos was set up by somebody who was in the diaspora. She built it. The cardiologist, Yemi Johnson, first cardiology in Lagos. He has a center. Emeka Douglas Oko, neurosurgeon. He's in Nigeria working. He's not been duped. Biodun Ogungbo is a Nigerian neurosurgeon doing spinal surgery. We can go on and on and on. They did their Ibrahim Wada has set up NICER Specialist Hospital. He left the UK. They were even begging him in the UK to stay back as a fertility specialist. He said, no, I'm going back to my country. Yes, but so due diligence, let me just wrap it up by saying, do your due diligence. Don't believe what everybody tells you. Oh, this big man, or that kind. No. You understand? We know about corruption in Nigeria, but due diligence is important. And please, I put my email in the chat. If you need to speak with me, Akin's there. He knows how you can get through to me. But let's the discussion keep taking. Anything that's worrying you. I mean, you said, I'm not going to talk about my age. I shouldn't even be talking. I should be in Barbados swimming or something like that. Yeah, I'm not retired. I'm over 70. I'm not retired. I'm still in full-time employment.
You don't look 70, Prof.
And I'm still doing lots of things, and I still want to study more. So, my brother, let's work together. Okay, thank you.
Yeah. Please, I also like to add this. Please, you can join us in the WhatsApp group because we need people like you, sir. People who already know what they want to do, and then so that we can move forward and we can make things happen. So,
yes, I've joined the WhatsApp group, and I've also indicated the interest in the Facebook group as well.
Okay,
so I've done both of them.
Okay,
Yes,
sir.
Thank you very much, Prof. Thank you very much, sir. I will be in touch. Yes, sir.
Yeah, thank you.
Thank you. Yeah, thank you very much. All right. I want to thank Prof for sharing some of his time with us this evening, and I believe that it has been a very insightful moment for us to learn and to know some of these things, and we intend to keep on with the conversation. So just like I said, next month we're planning to I let the cat out of the bag early, but at least it's good that we know what is coming up ahead of us. So these are all avenues for us to get to know more about some of these things, because information is knowledge, and information is power, rather. So as just like Prof said, if we don't want to fall into the wrong hands, we need information and we need to know where exactly to go so that we can get things done. And one of the things that I think is actually very, very important for us to do right now is to collaborate, just like Prof said, collaborate with the liaison center in Abuja so that we can be on the same page and we can help those who want to. I think my goal personally is to help people to bring their vision to reality, and as much as we can do, we'll be ready to do that. I've got goals too that I want to bring to reality, so we're all on the same page and we're all open to achieve the same things. Once again, I want to thank Prof very much for coming. Thank you very much, sir. We do not take this for granted. We know you're very, very busy, but you still found time because you were really passionate about it, and you still found time to be able to come. There's someone's hand that is raised up. I want us to take that last question, please, so we can wrap this up quickly. All right, you can go ahead with your question.
Oh, hello, good evening. Thank you very much, Professor Jaiyesimi. My name is Oladile Odusami. I'm a GP in UK. I sent my question directly to you. I operate in Nigeria as part of my giving back. But one thing I noticed, and I believe that will help us, is about the health insurance scheme. And this started as far as 2004, I believe, NHIS. And we now have Ilera Ipo, a lot of HMOs. But the uptake is very, very low, 3 to 5%, almost 20 years after this started. Is there anything that can be done in that direction? Because I believe it will help us a lot.
Yeah, I think with the HMOs, which is about universal health coverage, the 3% you're probably even talking about are probably military, government, some departmental staff. But people are still talking about that. We need to increase that, the access to finance, health. So again, if that's one area you're passionate about, it's about engaging with government, talking about it, having a webinar. I mean, there was a group that invited the health minister, Pate, to what they call a town hall meeting. And let me tell you what happened in that meeting. There was a girl, a lady, who said she was working with maybe NAFDAC and that she was doing X, Y, Z. And the minister said, oh, really, you're doing that? I want to see you. And the minister kept his word and saw the lady, had an appointment with the lady. And I'm sure from there, things would have gone on. So the national there's money in the NHRS. It's just not disbursed. There's a large amount of money in that scheme at the moment. Even you see, the problem is this: even when that money is disbursed, until we curb that corruption in Nigeria, that's a problem. Let me put it this way: corruption is a big problem. It's one of the things that's not making Nigeria work. And until people whistleblow, see recently how much they said they sold a boat that what's his name? I've forgotten, who is in oil and gas. Diziani was the one. She's saying she wasn't involved, but she was the petroleum minister. If she's innocent, why doesn't she go back to Nigeria after 10 years to go and defend herself? No, until we deal with corruption. There's corruption in China. There's corruption in America. But if you are caught, you will be dealt with. The late Queen's daughter in the UK, she was driving over the speed limit. She got a ticket. So, but in Nigeria, we're doing big man, and look at what is happening to that lawyer. His name starts with F, fast something, because he said lawyers are corrupt. Then they're now putting him in police custody. No, we have to talk about it. I talk about it, and I'm not afraid to talk about it. So, but if we don't talk about it, then things will continue the same way. So, Mr. Oladele, let's keep the conversation going. Don't despair about the NHRS. America, look, see, there's corruption in the health insurance industry in America. If you know what is going on in the health insurance industry in America, people billing for what they didn't do. So I know you're talking about coverage. In America, if you don't have money, you can't even have health insurance, and then you can't have access to treatment. So let us not despair because of where we are, but let us keep working and chipping at the obstacles. Gradually, we will get there. We will get there. That's it. That is why, like I said, I could probably decide just to lie on a beach in Barbados or something like that. But no, I'm not doing that. I'll keep talking. Yeah.
Thank you very much, sir.
Welcome. My email is on the chat, but please contact Dr. Akinshiku if you want my WhatsApp number as well. You said you're in the UK, so let's talk.
Oh, yes, I'm on the same group with you on Nigerian doctors on WhatsApp.
Okay, the Nigerian doctors. Okay, that's a big group. So you can see what people are trying to do. Sheyi,
Yes.
Oyeshola, and co.
Yes.
Yeah. So we'll keep talking and engaging with government. Yeah. So
all right, so thank you very much for
thank you.
Yeah,
thank you.
Thank you very much for your contribution. And I think that we need to do a lot of innovative work around health insurance. And one of the opportunities that we have is to make use of what we already are used to, in the countries where we are, and we can import those technology back into our country to improve things. So I believe that the health insurance is something that can work if we make use of the necessary technology that we need, and then we also tweak it to work in our climate. And then a lot of innovation needs to come into place. And one of the advantages that we have is the fact that we have seen how things can be done, and we can easily translate those ideas and bring them into fusion and even make them work better back home. So it's a plus for us that we are where we are right now, and we can actually contribute and make things better back home. So there's a lot of innovation that is needed. I believe NHI is not something that cannot be cracked. We can actually make it work. We can increase the uptake, and it all depends on how innovative we can go with it. So one way to get involved in NHIS is to think about how innovation can come into place to increase uptake and to make it more effective, reduce corruption and all of that. And I believe that that's one of the things that we can do as healthcare professionals in diaspora. And so we have come to the end of the webinar. We thank you very much, Prof. Once again, thank you for coming to share some of your knowledge with us. Really appreciate it. And we keep in touch as some of the events go by. We keep in touch, and then we believe that you are also part of us too, and we're also part of what you are doing too. So we definitely keep in touch. We really appreciate your time and your presence. Thank you very much. Thank you for everyone that has made this possible. Once again, the WhatsApp group is on the chat box, and the Facebook link is also on the chat box. Please join us so that we can, and then we want everyone to be active. We want to receive responses now. Very soon, we are planning a family meeting or a house meeting and want everyone to be involved so that we can make some of these conversations, we can continue with them and we can know exactly where we are heading. So get into the WhatsApp group, get into the Facebook page so that we can get more access and more information. Thank you everyone once again for joining us, and then we'll communicate our next time for the webinar next month. We'll communicate and get it across to every one of us. We want to see you again next month, and please, if you know people who might be interested in what we're doing, please share the link across to them. When we send out flyers for our next webinar, please get the flyers across to them so that they can also be aware and they can be part of what we are doing. Thank you everyone, and we'll see you next time. Bye.
Thank you for having me. Thank you.
Yes, sir.
Yeah, bye-bye.